So we're doing just some basic walkthroughs and just some general introduction to some of the hospital beds. Right now we're going to do a general walkthrough on the Stryker InTouch Bed. Now the Stryker InTouch Bed comes with two mattress systems. It comes with the XPRT, which is the one that has the most features, pulmonary care. Basically it has percussion vibration and also a percussion vibration and also rotation, and then a low air loss mattress system. And what I want to do today is just walk people through some of the basic functions of the bed. Now, when you first get the bed, the first thing that I want to show folks is that the very first thing you want to do is you want to go to the scale feature. You want to hit 0 scale. You want to 0 the scale out. I'm not going to do it right now because I don't have a patient here. But what you want to do is 0 out the scale and then put the person into the bed, because what's going to happen is it's going to adjust the pressure of the mattress based on the weight of the patient. We sell a lot of these beds, and a lot of times what happens is that people will call and they'll say, look, the mattress isn't firm enough, or we're not getting the right firmness for the mattress. It's either too soft or too hard. But generally speaking, what's happening is that they have not taken the person in and weighed them. So once again, you just come out there to 0. What that's going to do is it's going to include the weight of the mattress. It's going to 0 the bed out. And then once the bed's been 0'd out, it'll say okay. And then what you're going to do is you're going to have the person get into bed. And that's going to allow them then to get the proper firmness. Now, we're going to go into support surfaces. These are the two main buttons that you're going to be using with this bed. You have a host of different features in here, but one of the features you're going to have is rotation. And the rotation feature, basically what that's going to do is it's going to rotate that person left, right, and center. And this is done to keep them moving so that they don't get sitting in one position for too long. It's really helped to design, treat, and prevent bed sores and skin ulcers. You can hold the person in that position. You can adjust the time. You can also adjust the angle. So if you see here, I'm pressing this down. I'm changing it from a 10-degree turn to a 30-degree turn. I could come over here, do the same thing. And then what you're going to do, obviously, when you want to start that is you're going to hit start. Now, one thing it's important to know is it takes a while for the mattress to adjust to get ready to start doing the turning. If you're not in the mattress, it's going to be very difficult to see that working. So once you hit that feature, give it a minute or two to sort of get the pressure right and to start that process. But once again, if you're not physically in the bed or the patient's not in the bed, it's going to be very difficult to see that feature working. Percussion. Now, percussion has to do with pulmonary care, lung care. Percussion is going to help break up upper respiratory congestion. Once again, you can set the level. It's going to basically work the upper part of the mattress, and it's going to thump that mattress to sort of replicate what a respiratory therapist would do in a hospital to help break up congestion. You can see down here, you've got the lung settings. You can see it's got the imaging there for that, but that's what your percussion feature is going to be. You're going to go ahead and hit start to start. You're going to stop to stop. That's going to be pretty self-explanatory. Vibration is going to basically go along the same lines. It's part of the pulmonary care, and that's also going to help break up the upper respiratory congestion, and then the mattress can also rotate while it's going through those features. And I don't have the side rails up, so you can see I'm getting a notice there to say to get the side rails up. So let's go over here, and we'll just go to the side rail feature. Now the side rails lift right up, snap into place. When you want to drop them down, you're going to just go ahead and lift up that yellow tab. This bed has an automatic brake system, so unlike many beds that have a kick-down brake, this particular bed right here has the brake. Well, it's right here on this. It's on the side rails also. But we would go ahead right here, just hold that brake button down, and now we've just set the brake. So you see that brake light is off. When we want to take the brake off, we're just going to hit N, and now the brake is off, and you can hear it just made that motion. Bed controls, pretty self-explanatory. You have the controls on each side of the bed, but you also have another set of controls here, and this is kind of nice because you can see the degree of angle. Many times you've got different settings referring to Trendelenburg, and different settings for different cardiac settings, hypotension settings, but you can adjust those as you wish. All these settings can be controlled right here from the bed, so as I lift that up, you can see the head of the bed is moving up. And then we've also got the bed exit. Now, bed exit, I don't want to get too much into that right now, but bed exit alarm, basically, the first one right here, the person gets out of bed, it's going to alarm. The second one, if you look at that right there, if any part of the body goes outside the rail system, if an arm goes over the rail, a leg goes over the rail, the bed's going to alarm. And this one right here, if the person starts moving, it's going to alarm. And that would basically be if you're in like a post-anesthesia care, coming out of anesthesia, that they want to find out when you're waking up from anesthesia or coming out of some sort of maybe surgical procedure, they would put that on there. Arm and disarm, obviously you would hit, you press this, each time you press it, it moves it to a different one. Then you hit arm, and then as soon as it goes off, you would hit disarm. But generally speaking, that's going to be used in a hospital setting. Hospital people will probably, you know, go through an in-service training for that. Patient info, that's on there, but once again, that's going to be more for hospitals. We just did the bed controls. We did the support surfaces. One of the ones that they do have on here, which I really like, is the firmness feature. So let's say you've gone in, you've done the firmness. You want to go ahead at this point and adjust the firmness, either softer or harder, more firm. Easy right here. You just press that up or down. You can control the firmness of the mattress. That's a great feature. And I think that's pretty much the majority of it. Now, once again, this is the Stryker InTouch Bed. This is just a basic walkthrough, but I want people to just know, once again, 30 degree settings right here. Once again, that's to keep the head up, the upper respiratory vascular positions. You have those, but if I was going to say, remember one thing, the one thing I would say that I get the most calls on is please remember, you can see I'm putting weight on the bed, so it's actually registering pounds on the bed, but now it's back to 0. But the number one thing you want to do when you get this bed is please, please, please go to 0 scale, 0 it out, hit OK, get the person on the bed, weigh them, and get the mattress firmness adjusted. That's going to be the most important thing. And then with these other features that you're going to get under support surfaces, you know, I do this a lot. I go through a lot of these features. To me, it's pretty intuitive, but you know, if it's one of those things where it gets a little overwhelming because you're not used to it, just go through the motions and do it. Once you get the settings at the comfort level for the patient, it's just a matter of hitting stop and start. These will go for hours. They'll go throughout the night. So if you're a caregiver, you don't have to get up at night to take care of somebody. You can just let the bed turn that person all night long. And once again, this is the Stryker InTouch hospital bed. Now, we sell this hospital bed. We also sell the bed right next to it, which is the Hillrom Total Care Sport 2. It's another air mattress bed that does lateral rotation, has a lot of the same features. If you're looking for air mattress hospital beds, if you're looking for beds to prevent and treat bed sores, skin ulcers, patients with MLS, AS, multiple sclerosis, cerebral palsy, quadriplegic, paraplegic, I mean, you name it, we've seen it, we deal with it, we take care of it, we provide the highest level of care to hospitals and to patients all over the United States and all over the world. Hospital Direct Medical, San Diego, California, Richmond, Virginia. We can sell these beds. You can get a hold of us in California, 858-263-4894, just on time there for the phone. 858-263-4894 for California. Virginia is going to be 540-327-7376. You can also get more information on the website, www.1hospitalbeds.com.